I'm ready whenever you are.
Vijay, can we go online?
We can start.
Yeah. Good afternoon, Doctor.
Good afternoon.
Yeah, a very warm welcome to HYSIA Net Series webinar on getting back to work after lockdown. And nice of you to have you around. And we wouldn't say we could get a better speaker than you, head of most renowned hospital chain across the country, the Apollo Hospitals Group. Thank you, Doctor, for joining. And we have 1 hour time. And so I go through, probably after an initial comments from you, I'll go through a series of questions and probably we could keep it interactive. So firstly, let me just introduce Dr. Hari Prasad. Friends, we have Dr. Hari Prasad with us. He's the president of Apollo Group of Hospitals. He oversees operations across Apollo hospitals in 6 countries with a total of about 9,000 bed capacity. Person of many talents. He was a Ranji player, represented AP in 81 and between 81 to 84, and has been awarded World's Greatest Leader for the year 2017 and 18. And he was also conferred as the Most Trusted CEO Award for the year 2018 by Asia One and Leaders. And he's also an author. He authored a hugely successful book called Impossible. Dr. Hari, welcome again. So we have close to about 400 plus registrations that which we have, and then probably people maybe keep joining in. Okay, and let me first set a little bit of a context. So with the COVID-19 outbreak, India went through several lockdowns. So now we are in lockdown 4.0 era, and which is a much relaxed way of lockdowns. But way back at back home in Telangana state, and then I think we have up to 29. The third lockdown is still active, May 29th. So we went through 4, and then what is your view how this pandemic is going to unfold in India and globally? As you could see, probably India has crossed 100,000 cases as of today. And for the last 1 week, if you look at the statistics, close to about 5% of the global net new cases is contributed by India. Okay. And how long this is going to go, and then when will be the peak? At the same time, also comment on what is the cure and vaccination scenario in India and then globally. Okay. People are talking about living with the virus for some time. So probably I think your comments should give us some facts and figures so that the IT fraternity would understand the veracity of the current situation. Over to you, sir.
Sure, thank you so much. And it's a privilege to be talking to some of the best minds in the country. Thank you for having me. These are unprecedented times, and we are battling our way through uncharted territories. It is a war where the enemy is invisible, a war where there are no guns and bullets, a war which has no boundaries or territories, a war which has no rules, and a war we are supposed to be winning with one simple but potent weapon, and that is sitting at home. I'm not sure even the most creative mind or the most crazy mind would have ever imagined a situation like this. The good news is we are winning the war, and that is for sure. I'm saying this with a lot of confidence and a scientific basis. Corona is not the first infectious diseases we have seen. Not long ago, we had swine flu, influenza, dengue, malaria, tuberculosis. All this happened every year. Except for smallpox and polio, we've not been able to eradicate any other infectious disease. There will be a vaccine or a definitive antiviral drug for corona, or we will develop herd immunity sooner than later. Since we started counting the numbers of corona patients and corona deaths, more number of people have died because of influenza, strokes, heart attacks, cancers, and other non-COVID related diseases. Soon, corona will become a part of the disease burden of the country, and the panic and stigma will disappear. However, this pandemic has taught us many lessons. Like any other crisis, created new opportunities. Our routine way of living and working has changed. A new normal has emerged, and this is with us to stay. I'll spend the next couple of minutes on what this new normal is about. One of the most abused phrases is, health is wealth. We have used it extensively without really understanding its value. Billions of dollars have evaporated into thin air over the last couple of weeks, and the value of health has never been better understood. Another phrase which we are very familiar with is, prevention is better than cure. We seldom paid attention to prevention, and corona has sent the world into a lockdown aiming to prevent the spread of infection. Emphasis on health and preventive healthcare are going to be a part of the new normal in the future. Corona is not going anywhere, and dealing with it will become a part of the new normal. If we are waiting for the virus to disappear, for lockdown to be relaxed, then we will remain at home for the rest of our lives. I will spend the next few minutes on how we can start operations and sustain them over a long term in your sector.
Sure, sir. One second, sorry to interrupt you, but any specific time frame that which you would approximate time frame for the vaccination, either a cure or the vaccine readiness?
Yeah. Now, whether it is a drug to treat the virus or the vaccine, there's a definite procedure to be followed and adopted, wherein first the virus is isolated, then the properties studied, and then a vaccine created, first used in animal trials, then used in human trials, and then before it becomes a regular mode of treatment or option available to the general public.
Right.
Now, this normally takes anything between 2 to 5 years, depending on the type of vaccine.
Mm-hmm.
But what globally has happened is they've given a go-by to the first few steps, and they've allowed human trials straight away.
Right.
So the vaccine or the specific drug is going to come sooner than most other vaccines or antivirals have come in. And I suspect it will be around a year, plus or minus, before the vaccine or a definitive treatment comes in for this virus.
Okay. Okay. So coming back to the original topic, sir. So 33% of the workforce is allowed to work from offices, but IT industry decided that they will achieve that gradually. They are not in a rush, but at the same time, employees as well as the management has got certain apprehensions in their mind. So what is the clinical issues that they should be aware of? What are the safety precautions that from employer front as well as employee front, which they need to be taking? Especially when employees go out and then come back, and then probably there are more vulnerable people at home, elderly parents, probably kids, infants, or kids below 10 years. So these are all the apprehensions which are going in employees' minds. So probably I think you should give them some direction and then guidance in terms of what are the precautions that we should be taking. Over to you, sir.
Yeah, sure. I've been actually doing quite a few of this. I've been learning of the webinars that I've been doing. So I tried to pick up something, some of the things which are very specific to your sector. But before moving into the individual...
Sir, slightly voice is a little fading now and then. So maybe, and then also slightly, actually your posture is a little down, sir. So I think maybe you could actually see the audience as well.
Yeah. So before getting into the actual precautions, I must tell you that we are in a very dangerous phase now. We are in a phase where there are a lot of asymptomatic carriers in the community. Asymptomatic carriers are those who have the virus in them but do not exhibit any symptoms. When the virus came into the country, we had people only with symptoms. And when they had symptoms, they would seek medical help and they would be quarantined or treated or isolated or whatever was the appropriate thing was done. So the general population had a lesser risk of being exposed to the virus. But now, since there are a lot of asymptomatic patients, the secret behind running a sustained operation for any organization is to treat each one of ourselves and each one of our employees as a potential suspect COVID patient. That is the most important thing to do in this phase where there are a lot of asymptomatic carriers in the community. Now, coming back to the different phases, the first thing is transport. People have to come into the offices from different places. So I'm going in a sequential order.
Sure, sir.
The most important thing to do is, one is to make sure that the driver is not infected. So we need to do the screening for the driver. And second is the cleaning of the vehicle. For every trip, the vehicle needs to be cleaned. The best way to do it is surface cleaning with 1% sodium hypochlorite or spraying 1% sodium hypochlorite. It is very important that it is done after every trip. That is, if the vehicle is picked up somebody and dropped them, before they pick them up again and goes back, it needs to be done. So at every stage, it needs to be done. And the driver needs to be screened continuously. And within the vehicle, if it is a four-wheeler, not more than 3 employees plus the driver. That is, social distancing must be maintained in the vehicle also. And all 4 in the vehicle must wear a mask, and the mask must be worn in a proper manner. These are some of the things which can help prevent transmission of the virus during transport, which I guess is a very important part of the activity which an employee in the IT sector undertakes. Now, the organization needs to get ready to get operational even before the first employee walks in. That is, we've shut down the offices for some time. Some are open, some are they are all in different stages. But it's important to make sure that we have thoroughly cleaned the entire organization. We've done a fumigation with 1% sodium hypochlorite. And most importantly, we have cleaned all the surfaces which a human being could be touching in the organization. And the best solution to use, once again, is 1% sodium hypochlorite. It is surface cleaning which makes a huge difference. And then in your sector, where a lot of keyboards, mouses, computers, and stuff like that are used, it is very critical to decontaminate them at regular intervals. And the best way to do it, I use my hand sanitizer to clean my keyboard and mouse regularly. Whenever I sanitize my hands, I use the same sanitizer to decontaminate the keyboard and the mouse. So the infrastructure also, you need to make sure that the social distancing is maintained while the people are at work. We need to ensure that at least 2 meters. 3 meters is a luxury, I know, but 2 meters is a minimum you should ensure between people at any point of time. Whether they're sitting and working, whether they're standing, whether they're going into the toilet, whether they're going to drink water, whether they're going to have a coffee. We need to make sure that social distancing is maintained at all points while they are in the organization. And then the usual culprits which cause a problem are the toilets and the cafeterias. These are the 2 places where the spread is noticed to be very high because people tend to remove the masks, especially when they're in the cafeteria, and they tend to get too close to each other. So we must ensure that the social distancing is definitely managed in an appropriate manner while they are outside their desks also. Hand wash. This is a new thing which we all need to get used to, irrespective of whether we are at office, at work, or outside. Hand sanitization. The simplest 2 things which we need to do is keep our hands clean and don't take our hands anywhere close to our face. These are the simplest things to be done, because there is, apart from the manual transmission of touching a virus on a surface and taking the hand to the face, the only other way you can catch hold of the virus is when somebody carrying the virus gets too close to you and talks or sneezes or coughs in front of you. So the other thing, apart from hand washing and not touching your face, is to make sure that your social distancing is there, so that even if there's somebody is coughing or sneezing, you're at a distance, and wearing a mask. Wearing a mask must become a part of our life, as we are stepping out of the house, as we wear our footwear. We need to make sure that we wear the mask, and the mask should be properly worn. 99% of the people I see around in the community are not wearing the mask properly. The mask should cover the nose and up to the chin, and we should not be touching the front of the mask at any point of time, including while wearing it and removing it. While removing it, you need to use the ribbon which is there behind, which is holding the mask on your face, to remove it rather than pull it out from the front, because that's where the virus is. And there was also a lot of talk about what type of mask is to be used. Simple homemade mask with the proper cloth is adequate for this virus. One of the properties of this virus is it is a heavy virus. It's a relatively bigger sized virus, and it is a heavy virus. So you don't need to have really an N95 or a respirator type of masks to be able to prevent this. A regular cloth mask or a regular 4-pleat surgical mask is adequate for this. And second thing which you need to understand is this, because of the nature of the virus, because it is heavy, it doesn't stay in the air for very long. That's why we say a distancing of a certain 2 to 3 meters is adequate to prevent us from contacting the virus from the other person, because it tends to gravitate downwards and fall down on the surfaces which are there in front of the person who is infected. And that was the reason I said you must clean the surfaces and disinfect the surfaces. And the virus is not in the air, it is on the surfaces, and we need to make sure that we understand that. Cough etiquette, enough has been spoken about it and taught, so I don't want to take a lot of time on that. Then, as you said, both at home and at work, there are this high-risk population. Now, who are this high-risk population? Above 65 years of age, people with heart diseases, people with hypertension, people with diabetes, people with cancers. So if they are employed with you, please keep them at home and give them work from home. And also educate your staff, rest of the staff, that this is the vulnerable population and they need to be taken care of at home in a special way. I would actually go to the extent of quarantining them at home, because they are the vulnerable population and we need to take special care of our elders at home. So we need to go to the extent of quarantining them at home. While I've been saying that we need to wear a mask as we step out of the house, it is probably good if the elders at home are actually wearing masks even while at home, and then following all the other precautions of social distancing, hand washing, and the rest of the stuff. And then,
one second, doctor. So especially the employee who comes back after the work, right? And then probably you can be a little prescriptive in terms of what kind of a precaution that which he should take. Please.
The next thing is, all our offices receive a lot of material, whether it's couriers or whatever comes in. And the tendency is to just pick them up and open them up. And even at home, today, we're doing a lot of online shopping, and you get these Amazon couriers and stuff like that. Now, one thing we must understand is, on cardboard, it has been proven that the virus survives longer. So the guy who is bringing you do not know who is bringing the parcel to you. You do not know how long he's handled it. So it is always good to be very careful about handling these parcels. There are two ways of doing it. One, if you can afford to do it, leave the parcel alone in a place outside for 24 hours before you touch it, or give a separate room for these parcels, so that they are kept in that room for 24 hours before they're taken out and opened up. Or please wear glove, open them up, remove the contents from inside, and dispose the glove in a closed bin. These are the two things which you need to do. And especially at workplace, please have a central place which there's only one person who's wearing the personal protective equipment, including the mask, goggles, and the glove, who is receiving it. Because the weakest link in the chain is our biggest problem, and this could be the weakest link in the chain. So please make sure that when you're getting stuff into the offices or the organizations, you're paying adequate attention to the way in which you're receiving it and handling it. Now, again, the next thing which we've seen is a majority of infections do not happen in the workplace, because workplaces, they do take some amount of care and people are careful. They happen outside the workplace, and it is these employees who come back to work. And I've also talked about being asymptomatic. So what we need to do is, whether it is on the first day the person is coming back or is continuing to come back, screening the person before entering into the organization is a must. Screening every individual, and 2 or 3 basic things which we could do is, one is the thermal screening, which use the non-touch method. 2 is asking him questions. Did you go into a crowd? Were you exposed to anybody who has a cough, cold, and fever in the last 24 hours? And did you have a running nose or fever or cough or a headache? So these are the basic things we need to do for every employee, every visitor walking into the hospital. And I would go to the extent of taking a declaration saying that they have not got into contact with anybody with a suspected infection, they have not been in a crowded place, they have not had symptoms themselves, and getting it signed off before anybody enters the organization. This may have some legal protection. You don't know how this turns up at a later point of time. So screening of an individual, not just the first time when you open the office, but every time a person comes in, is very, very important and must be done at every organization. And it's also time we spend in educating our employees about what to do outside the organization also is equally important. All of us do spend a lot of time on the SOPs within the organization, on how we need to do things within the organization. But we've not really spent time on what they should do outside the organization. So this is the time where we need to give it enough time to educate them on what they should do outside the organization, because in the organization, they may be following all these social, distancing, wearing a mask, hand washing, and the rest of the stuff. But once they go out, it's a human tendency to take it a little easy. So we need to make sure that we educate the people that the same thing which they're doing in the office, they need to continue to do outside the office also and at home also. And it is not enough if the employee follows it. The employee should make sure that the entire family at home is following it. Apart from the precautions which I have spoken, it's also wise not to have visitors home during this period, at least for the next couple of weeks. So it is very important to educate the employee on what he should be or should not be doing once he's outside the organization and at home. And there is a lot of hype which has been created about this virus. And the death rate is less than 3%. And the death rate, even this 3% of people are the high-risk population which we spoke about. So majority of your workforce is in that age group which doesn't fall into the high-risk population. So even if somebody contacts a virus and becomes COVID positive, the first thing to do is not to panic. The best way to deal with it is to deal with it as we deal with an influenza. Even when we get a common cough and cold, we do take precautions to make sure that it doesn't spread to our family members. We ask them to keep away from us. So we need to treat it as a common cough and cold and take that additional precaution that is required to make sure that we do not spread it to somebody else. And be assured that to us because the statistics are telling us the world has seen that it is only the mortality is only in the high-risk population and it is less than 3%. And in our own experience, what we've seen is 95% of the people who turn positive do not require treatment beyond the normal flu. 95% of those who turn positive. 5% of the people need some additional care. And in this 5%, less than 2% of them need intensive care. And less than 1% are actually getting onto a ventilator. So now, as I told you right at the beginning, there are diseases with much higher mortality and morbidity in the community who are getting scared to come out of the houses and dying at home than the COVID virus itself. So we need to demystify this for our employees also and make sure that they understand the reality. And the reality is proven by the statistics, proven by the facts, and we're not talking something which from thin air or something which is rocket science. It is simple statistics which prove that it is not a virus which we need to be so scared about, and we need to be sitting at home and not getting out of our places or doing funny things. So educating these people and creating awareness is one of the most important things to make sure that they come back to work, they are productive while they are working, and they are psychologically not demotivated. One of the things which I have done in the last 60 days, because we are in healthcare and we are handling a lot of COVID across the group, I have learned to become a psychological guru and a spiritual guru. I said spiritual guru is because nobody can predict who is going to get the virus. It is in the asymptomatic stage, so nobody can predict it. So I've been praying that people should not get it. That's why I said a spiritual guru. And psychological guru, because a lot of people, because of misinformation, wrong facts, which are being spread across the system, they've created a hype about this, they've created a fear about this, and they've created a stigma around this. All this needs to be removed. And I think that is the best way. The best way to do it is to give them the facts and to tell them what the actual virus is about. And we've been doing this for a lot of companies and organizations because they hear it from a doctor's mouth and they understand it from a doctor. The employees tend to understand it better and they tend to take it better. And we are open to have our doctors go to any of your places and talk to your employees or connect virtually and talk to any of your employees. Please do not hesitate to contact us. We are there to help you. One thing which we need to make sure that our employees need to understand is that change is unavoidable. The COVID has made sure that we have to change our behavioral patterns. We cannot be what we were in the pre-COVID stage. Whether it is social distancing, hand washing, hygiene, all these things have to be there with us, have to become a part of life. Now, once we understand that this change is inevitable, then the psychological, and we accept this change, then the psychological status improves significantly because people tend to adapt to it. So we need to make sure that they understand and they bring this behavioral change into them. And the last thing I wanted to talk about is regular health checks. We've been talking about health checks for ages, but health check is the last thing on anybody's mind. But I guess we've reached a stage where regular health checks do prevent not just COVID complications, but a huge number of other diseases. Non-communicable diseases like cancers, heart attacks, and the rest of the things actually are responsible for over 70% of the deaths in the community today. And all these are preventable deaths. So we need to make sure that health checks are becoming a part of our daily routine, and we do it at least once a year, once we cross the age of 35. So before I take questions, I just wanted to end by saying COVID has done a lot of things. It has also brought in new jargon. For example, being vocal about local. And when somebody challenged it by saying that we're isolating ourselves from the rest of the world by becoming local, then this word came up called glocal. I'm probably talking to an audience which is already glocal, and I think very, very important to protect this set of people whom we are talking to and the people whom we work with you, because India depends hugely on all of you. And as a healthcare organization, we are open to do whatever you want us to do to help you, right from doing an audit, standing with you to create your, open up your organization, doing regular audits, doing regular screening, talking to your employees. And then one last thing which I wanted to do was, while we do all the training, while we do all the education, implementation is the crux of the whole matter, whole issue. And the only successful thing which we have seen is to create a health committee in every shift of 2 or 3 people, depending on the size of the organization, whose only job is to see whether the precautions are being followed or not being followed. They don't do anything else. They keep walking around the organization and just see whether the precautions are followed or not followed. And they're not followed, to make sure that they are being followed. So this is the only way we can make sure that all the education, all the awareness that we are creating results into something evident on the ground. So that's what I thought I would say to begin with. But I'm sure you have a lot of questions.
Yeah, sure, sir. So I think it was quite informative, actually. I think some of our audience are asking the recorded version of it. So probably, so one question, very trivial. So I think, what is that liquid that which you talked about, 1%? So they're asking you to once again say it.
I think we have bleaching powder.
Oh, okay. Okay.
We call it sodium hypochlorite.
Okay.
One thing you need to remember is you need to use only 1% of it. Take 1 ml of bleaching powder, dilute it with 99 ml of water, then it becomes 1%. It's nothing. The cheapest. Luckily, the virus is susceptible to the cheapest disinfectant that is available in the world.
Right. Thank you. So I think one statistic, I think probably from your group, which has come out, actually, the COVID is the 40th reason for death in China during the peak time of China going through which means there are 39 other diseases which are causing more deaths than the COVID is causing. So I think that should comfort quite a few of us. And I think, the demystification of some of those myths that which you talked about, I think it's very, very useful. Each of the companies have to definitely educate their employees, through the employees, their families as well, right? So one question which remains, so I think companies take those precautionary measures and then employees get educated, but unfortunately, if there is an incident, right, in any of the organization, how do companies go about handling this incident? And then is there any techniques that which you could tell us that, like, how to minimize the impact of incident? Are there any ways and means that which we could minimize it?
Yeah. I mean, I'm talking based on experience and based on what I've learned from some of the companies. One is to stagger the shifts. Instead of having 100 people coming in at the same time, to stagger their incoming and outgoing timings. That is one. And second thing is, not to have the whole bunch of people at the same time in the organization. Like for me, what I did in the hospital is, we have 3 shifts for our, because we run a 24/7 operation, we have 3 shifts. And it was an 8-hour shift per shift.
Right.
What we did was, we converted it into a 12-hour shift. So we have 3 batches of people, 1 batch of people which works for 12 hours in the day, and another batch which works for 12 hours in the night, and 1 batch which is resting for the whole week.
Okay.
So that is how we staggered working this thing, so that even if 1 batch, 1 person gets infected and we have to quarantine a certain number of people, we readily have a bench strength which can come over and take over operations. And one thing for sure, we cannot afford to stop operations after having started it. So we need to make sure that we stagger the shifts. Second thing which you need to make sure is, if you have taken the precautions, you are not going to get the virus within the organization. If somebody becomes positive, you can be rest assured that they have contracted it somewhere outside. Right. And if this person is coming to the organization, first thing is not to panic. Second thing is, if you have maintained the social distancing and taken all the precautions, you can be rest assured that nobody is going to get infected. I'll give you the reason why I'm saying that. The first case in Hyderabad happened in our hospital in Secunderabad.
Okay.
There was no COVID at that time in the entire state or in this region itself. So this gentleman came back from Dubai. He went to Bangalore. He worked in a software company, worked in Bangalore, and then came over to Hyderabad in a bus, stayed at home, and on the 5th day of the thing came to the hospital with fever.
Okay.
And once he was diagnosed, he was moved to Gandhi because at that point of time the government wanted to handle the patient. And there were 34 people within our organization who were exposed to this person, who were in touch with this person. They tested all the 34 people, not a single person was positive.
Okay.
So if you maintain the precautions, take the precautions, you can be rest assured that you're not going to get hold of it at work.
Right, right. So basically what you're saying is, I think even movement of people within the companies also, it's better to in smaller groups probably. So even when they are breaking for lunch or breaking for tea or coffee or whatever it is, so that like you will be able to actually isolate the spread within the small groups.
Another interesting thing which can be done, I don't know how far it is possible in your sector, is a one-way flow of people and material. That is, people don't cross each other, they move in one direction. So when that happens, even that is supposed to have a protective effect on the prevention of catching the virus. So that's another thing which could be adopted if it is possible within the organization.
Very valid suggestion, sir. I think good number of large companies have those provisions, except for some SMEs. I think we definitely have some challenge, but I think it could be widely followed, actually, your suggestion. I'm just picking on one point, sir. I think we earlier also had asked, India crossed 1 lakh cases, active cases, positive cases. And we don't know when is the peak. The peak is 30th of June. The peak is July, whenever it is. When that reaches, then probably there's several lakhs of cases in India, right? So is the medical infrastructure geared up? Okay, number one. Number two, I understand that ICMR approved at least 10 different testing labs in Telangana itself. But for some reason, government is right now actually allowed very few government hospitals. So there are sometimes there is a little bit of apprehension also for people to go all the way to Gandhi. Rather, they might feel comfortable to actually come to Apollo or go to a Vijaya Diagnostic Center and then get it tested. You have any view on this, sir, about probably the reason?
First thing is, I don't think we should be worried about the number of cases.
Okay.
I talked about herd immunity as being one of the ways where this influence or impact of the virus would come down.
Okay.
So I think if you're talking about a lakh of people today, there would be 10 lakh of people who are asymptomatic carriers in the community already.
Right. Right.
So don't worry about the number. Don't worry about the peak.
Okay.
The worst thing that we're doing at this point of time as a country is not only us, anybody is counting the number of patients.
Okay.
And the good part of it with our country is we have a younger population compared to the Western population. Second thing is there is definitely some sort of an immunity in our population, whether it is because of the BCG vaccination or because of our constant exposure to different types of infections like tuberculosis, malaria, and stuff like that. There is definitely an increased immunity. So we're not seeing the same sort of pressure on the hospital infrastructure as the West is seeing.
Okay.
And even today, as I said, 80% of those who test positive do not need hospitalization.
Right.
So even if the number of patients go up by 20-fold, 30-fold,
okay,
the government has created enough infrastructure, the private has enough infrastructure, and infrastructure is never going to become a problem.
Okay.
Second thing is about the testing in Telangana. For some reason, the government believed that they should do the testing. And I understand the apprehension in the minds of people. So what we do in the hospital is, in Jubilee Hills or any of our hospitals, there is a very strict screening mechanism before anybody enters the hospital. And any suspected patient is sent to a fever clinic, which is outside the premises of the hospital, right from the entry. In the fever clinic, a thorough screening is done. And if a patient is suspicious, a swab is taken and sent to the government hospital. The patient remains with us. Patient doesn't go there. And once the report comes back, if he is positive and if he wants to continue to be treated at our facility, which is outside the hospital, he continues to get treated, or he has an option of going to the government facility. So I don't think it should be so much of a worry. It is the mindset which needs to change.
Okay, excellent. So I think this is a very valuable information for our viewers. Coming back to the cure and then probably vaccination, sir. So I think it was also when I was actually looking for some data, then I think I realized that like India is the largest producer of vaccines in the world. 80% of the WHO vaccine procurement happens from India, right? And 20% of the global generic drugs are manufactured in India, right? 45% of that demand for US and then 25% for UK is taken care. So with more than 100 FDA approved manufacturing plants in pharmaceuticals that having. So do you think that India probably will be ahead in terms of actually mass manufacturing of vaccination and making it available for this population for the rest from the rest of the world?
I know four of our labs which are working on the vaccine, and I really hope that India would be the first country to come up with a vaccine. But historically, we've not invested enough into research and development of vaccines. So what used to happen is it used to be developed somewhere else, but they never used to have the capacity to produce the numbers or the volumes that were required. So invariably it used to come into India, and India has a fantastic pharma setup which could produce any volumes. And today it is called the pharma company, pharmaceutical for the world. Hydroxychloroquine, how many millions of tablets would have gone out, God only knows. So even if a virus is, a vaccine is not identified in India but is identified elsewhere, I think Indian pharma has and the biotechnology sector has the capability to produce enough vaccine, not just for India, but a significant part of the world. So we can be rest assured that once the vaccine comes in, we will all have easy access to the vaccine. That is an assurance.
Right, sir. So before there are a lot of questions from the audience. I break for the audience questions. Listening to you, to this session, so I get a feeling that I think we should not be overly worried as a community, okay? And I think we should not stop our regular activity any longer, right? And get out of homes and then get to offices, do our work, but take those precautions, okay? Be it social distancing, workplace-centric precautions. When we go out, whatever that is advised, right? With those, I think we should be all right, even if we go back to the work. That's the message that which probably that I hear from you.
My message is please go back to work.
Excellent. Excellent.
In our hospital, we have even the administrative team across the country has worked through the entire period, even the worst lockdown. There was a movement saying that administrative team does not come to the hospital to work, they can work from home. But we said our frontline people are our nurses and doctors, and they are being exposed to the risk. What right do the administrative team have to sit at home and have a holiday? So throughout the entire workforce is at work, and there's nobody who's got infected with COVID.
Sure, sir. So sip your tea and then I'll browse through the questions, and then if it is something which you have not answered, I'll pick some of those and then come back to you. So some questions, sir. So I think what is the frequency of that sanitization in the office premises? But I think you kind of answered it. Yeah, but please go ahead.
Every shift.
Every shift, right. Should the health committee have doctors and as a member of the committee?
No, all it needs is people who can see properly and who are sincere and honest about what they're doing.
Okay. Yep. Yeah, so I think some question which is about actually MHA order is only 2 persons in the car, and probably I think that might get eased up with the 4.0. So yeah, one interesting question, sir. Would weather monsoon add to the problem? And adding to that, actually, even I wanted to ask, people are talking more about the spread of the virus. It would not happen through air and all. But however, what happened to the water? So let's say if probably somebody has touched some part of water, and then probably, especially in the monsoon season, it is possible, right? So probably you could comment, sir, on this.
There are two things to this. It was generally felt that the virus doesn't survive in high temperatures. But unfortunately, this virus has not behaved that way.
Right.
Because if you've seen, some of the hottest places in the world have been, like you take the Middle East, you take Singapore, you take India in summer, all these places have had the virus, and it is surviving through the summer.
Okay.
And, the monsoon is not going to make any big difference, except that it's going to bring in dengue, malaria, and other infectious diseases and add to the disease load. But it's not, I don't think it's going to make any difference to this virus.
Okay.
And it doesn't spread through water. That's another thing which I wanted to make.
Okay. Great. So one question, though it is something related, you said that like asymptomatic itself is basically, there is no symptoms which are visible, but I think the question is, even if in the asymptomatic people, is there any indications that which we would be able to notice?
You need to ask, along with the thermal scan, you need to ask a few questions, whether they've been exposed to anybody, they've been met anybody with cough, cold and fever, or in the last 1 week to 10 days, or they've been to a public place. So these questions, which I told you as a part of the initial screen, were to make sure that these asymptomatic carriers, we may be able to identify a few of them because of this.
Okay. Right, sir. What type of PPE required to be worn by the security guards who screen the employees is one question, sir.
Goggles, mask, and glove. And please practice a no-touch method of screening. Please practice a no-touch method of attendance.
Attendance. Okay.
These are two things which are very, very important for the organization.
Any guidelines in the operation of central air conditioning for IT officers, sir?
I've gone through, a lot of people have been asking this question, so I went through a lot of literature across the world.
Okay.
They have found the virus in the AC ducts.
Okay.
But they have not been able to prove anywhere in the world that this AC ducts are responsible for creating a human infection.
Okay.
Like they found the virus on cats, but they have not been able to demonstrate that the cats are capable of transmitting the virus. But what I would still suggest is, if you've been shut down for a while and if you're opening up, clean the filters before you actually start working, so that whatever safety measure or whatever better thing it happens, it happens.
Yeah. So there are some, I think, people who got treated and then now they have become negative, and then they are there outside, right? So are there any further infection that is somewhere? I think some news in China that like there are symptoms are coming back and so on and so forth. Is it a myth, or is there any element of truth in that?
They have reported, I'm going purely by the literature.
Your voice is a little fading now and then. Yeah, please go ahead.
I'm going purely based on literature, medical literature.
Right.
been published by authentic sources. They have seen transmission of the virus up to 30 days of infection.
Okay.
They have not been able to demonstrate it beyond 30 days.
Beyond 30 days. Okay.
And in fact, all of you must be have heard about this serum therapy for patients with these antibodies from these infected people, where we are taking the blood from the person, collecting the antibodies and injecting it back into the infected person in serious cases.
Right.
So after 30 days, they've not been able to prove any transmission at all.
Right. So 40% of our workforce, or more, maybe more than that, actually use public transport, sir. So while employees actually traveling from home and back home, so are there any specific precautions or guidance that which you could give?
I think whatever mode of transport, the precautions should be the same.
Okay.
And I think the only thing which the government should not start, it should open up everything except public transport, unless they've been able to do the social distancing and cleaning on the public transport system, which I'm not too sure. If that doesn't happen, that could create a huge wave of infections in the country.
So you suggest that probably the preference should be given if there is a company arranged transport, or probably own vehicle, two-wheeler or something like that, as long as it is available?
Or even a company arranged bus is fine. Because you are doing it, you will make sure that you are cleaning it properly, you are maintaining social distance. The organization will take responsibility.
Right.
When it goes into the public system, I'm not too sure of what will happen.
Yeah. Right. So one final, but one question, sir, especially small kids at home. Okay. And then probably it's nothing to do with schooling system, but I think we have children, so who are school going, right? And so any specific precautions? I think schools are not now, and maybe a month down the line or a couple of months down the line, but I think still probably you could actually give us a couple of suggestions on that.
Children who can understand things are safe.
Right.
You know, not to cough out, or not to get too close to somebody, and they can understand and follow the precautions. They are as good as the adults. But the real challenge comes with the toddlers who don't understand stuff like this.
Right.
And as parents, we cannot leave them on their own to do their stuff. And we've seen a lot of children who have a cough and cold are very common in young kids. And we don't know what is what. So the best way to do it is, what we've been advising is, when the child is having cough or cold or some symptoms, it is good for the parents to wear the mask while they are handling the children. That is a sensible way of handling these kids. And the second thing is, even once the schools open, it is the same standard precautions which need to be followed during transport, at school, back home. I think for anything, the precautions will remain the same. And I've said this before, I'm repeating it. These have to become a new pattern of living. This behavioral change has to happen, and we will be extremely safe once that's it.
Right. So we more or less actually done with all the questions, sir, even audience questions, quite a few of them which are relevant that which have been taken. If there are anything which we have not answered, probably we can actually offline, we can actually send them the answers. And audience, this session is also recorded, and then probably those of you who found it actually a little difficult to hear at times, and then I think there's a recorded version. We will ship it to you. Thanks a lot, doctor. And I think almost you've given us a comfort. The IT industry is comforted by talking to you that I think we'll have to get back to work, and not to worry too much about it, but take precautions. And I'm sure, I think tomorrow onwards, you will see more number of people going back to offices. Okay. Thanks a lot. Thanks a lot for taking time, sir. So most of your explanation was actually liked, and then I see some comments by the audience that I think very patiently you have explained, And thanks for joining us. And then we look forward to work with you in future.
And I just want to assure everybody that we are with you throughout, whether it is right from the stage of opening the organization, to screening, to cleaning, to suspects, to treating. We are with you throughout. Please don't hesitate to contact us at any point of time. We will be there, and we'll be, whether it's online or whether it's physically there, we'll be there to help you out.
Thank you, sir. Signing off, HYSIA Net Series session 5, getting back to work after lockdown. And thanks a lot for joining. And thanks a lot for our sponsors who made it happen. Thank you.
Thank you. Bye-bye.